You're going to fold it on top of itself in half. Okay? And you're going to have the patient lay back, bend your knees up. And we're going to put this cuff so it's right in their lordosis, right in their lumbar spine. Okay, now, we have some cuffs at our clinic that, if you guys have seen it, have like this all attached as one piece. You know what I mean? So the bulb and the dial is all together, which is really nice because the patient can pump it to look at it itself. Sometimes we'll have patients that are struggling with this, tell them to go to Walgreens and buy a $15 blood pressure cuff because it might help them. But it does help them, even if you only do it in the clinic, it does help them get the feeling for what we want them to do. So it's in their lower back. I'm going to start to pump it up. I want you to let me know, Kirsten, if it feels like it's in the center, okay? Meaning not off to one side or the other. And I'm going to inflate it all the way up to 40 millimeters of mercury. Center? Okay, I'm going to let you hold that. Now, what I want you to think of doing, still at 40? Move your legs. There you go. What I want you to think of doing is I want you to think of tightening up your stomach muscles a little bit, bringing your belly button down towards the bed, down into that cuff a little bit. What I want you to do is I want you to get that needle from 40 to about 50. 50, not 80. Okay, that's overperformance. What happens when we overperform? We get all this overflow to other muscles, right? Which we don't want. So I don't want this brace, this abdominal brace, joint in, whatever you want to call it, to go anywhere above 60. I want you to stay between 50 and 60. And Kirsten does that pretty well. So what I might have her do is relax, and sometimes you lose a little bit, is just go up to 50 and hold it for 5 seconds. Okay, try not to let that move. She's doing a good job, I can see, of not holding her breath, because that's the first thing most of your patients are going to do. And relax back down. Okay? And back up again. That might be the only thing that she goes home with on that first visit from a stabilization perspective, is this exercise. Okay? Because most patients, oh, you're dropping there a little bit. Most patients aren't going to be able to do it as well. Okay, so I'm going to show you a couple ways to progress it, and then as you're doing it yourselves, we'll kind of talk through a few ways. So now relax. What I want you to do is you're going to go up to 50 again in a second, and then what you're going to do is you're going to slowly let this leg fall out to the side. Okay? Come on back up. All right. If she doesn't brace, watch her pelvis. Slowly let that leg drop out to the side. Whoop. What just happened? Did you see how that just went like that? Okay? So that tells me that she has poor stabilization there. So what I want you to do is tighten at 50, slowly let this leg drop out to the side without letting that needle drop at all. Slower. Yep. It's hard to do. Huh. What do you know? Back up. Whoa. Okay, so there's her exercise. She's got to work on that. It's hard. I know it's hard. Okay? So I want you to try that. Start with just trying the abdominal breath.